Hello, my name's Lucy and you're listening to No Clinical Trials Were Harmed in the Making of This Pandemic podcast. I'm here today with Claudia, Julia, Celia and Amy, and we're going to talk about our experience during these crazy times. Right, so where to begin? Can anyone actually remember what happened in March?
No.
I think we were just so adrenaline fueled that, we just kind of got on with it.
I can remember you telling me that I didn't need to worry about reading the protocols for the studies in hibernation when I started in December because that'll never happen. Famous last words.
And that's been going on since what? 2013 when you first set that up?
Yeah. So I remember setting it up, reading this protocol, thinking, yeah, this is never going to come off the shelf. And it gathered dust for many years. There was a slight moment when we thought we might have to inactivate it for Ebola.
Yeah.
But then it went back, it stayed on the shelf. And then I remember messaging you when the news said about it getting busier in China. And I said, this will be the next one for the Isseric study.
Yeah.
And I think even until a week before we got our first patients, we were like, nah, it's not going to come over here. We might get one or two patients.
Yeah.
Kind of brush up on it. And then
it hit
800 patients. Maybe just one or two.
Yeah, we just had to make do with what we had, really, didn't we? It was just, here's a study, run with it. Yeah. And I think we did. We did all right.
Yeah,
we recruited 102 patients in the space of 2 weeks, and nobody in Dream went off sick, which is, very reassuring.
Very reassuring. It was...
I remember the time when we were quite unsure of what was going to happen, but then Phil turned up.
True.
With no beard. And then we knew something was about to happen.
He was the whizmaster at it.
He was.
Yeah. You used to go over to City and just recruit 20 patients in a day and be like, yeah, done.
And then we had 20 day 3 samples and 20 day 9 samples on top of the 20 patients.
But that's when R&I came in and they really helped us save the day, didn't they, really? We had all these extra people to just, train. Raise a hand to the R&I team that gave us all the chocolates.
Yeah.
So we were fueled by cakes and...
They got us through many days.
Diet Coke and, all the things that you needed at 2:00 in the afternoon after you'd seen all those patients and you were covered in sweat from all the PPE.
Because although the study was changing daily, so was the PPE.
Yeah.
Especially on crit care. One day it was, you got used to it, it was fine. The next day it was something completely different in a different place.
Yeah.
And some areas were hot and some areas were cold and you now couldn't go into the area you went in yesterday. I think that was
It's kind of challenging as outsiders to the clinical areas as well, because obviously they would have been told the changes in the morning at 7:00, and then we kind of come in as not strangers, but we just come in as outsiders, and 10:30 in the morning, and we don't know. Everyone else is just used to it by then, and you're just like, what do I do? Luckily, everyone was very kind, weren't they? And they, nobody let us do anything that we shouldn't have done.
That was true. One area from another, though, wasn't it? You just had to literally learn. We learnt very quickly. Whatever area you went onto, you just asked what their policy was in that area. And did what they did.
Yeah, just follow suit. It was really good.
And not one positive swab between the teams, so we did pretty good.
I think so.
I think we should probably touch some words.
Let's wait till we get all our antibody tests done and then we'll see.
That will be intriguing.
The spreadsheets.
Definitely
the spreadsheets.
Who really enjoyed the first spreadsheet that we didn't quite know what was going on?
I don't remember the first one. Dramatic. It's blanked out.
Oh dear.
The amount of emails I've got that are entitled spreadsheets.
Yeah.
It's just like...
It just grew, didn't it? I think the first one was it Isseric, which was just like a screening log that we would normally have.
Yeah.
And then we realised that we were having to screen all the wards, so then the ward log came along and we had, and then they've changed and evolved as we've gone along.
I think every shift I work, there's probably a new spreadsheet that I didn't have a clue about. So I had to spend the beginning of my shift learning about that.
Yeah.
And then it was changed the next shift. But It's all part of the learning process.
Well, I know that's the most common term, isn't it? As soon as you walk through the door, right, what's changed?
Yeah.
What do I need to do now?
And there's always an answer.
Yeah.
And the patients had to be added to every spreadsheet, so they were on multiple spreadsheets.
Yeah, you kind of knew, thought that you knew every single patient, didn't you? Even though you'd never met them before, you knew them by their name.
Yeah.
You knew if there was a family in. That was one of the sad things, really, when we used to see couples in and families all in.
Yeah.
Which was, but some of them were lovely, weren't they?
That's true.
They were really nice. So, yeah.
And on a mental health note for workers, I think it was quite difficult to see. Obviously, we see in all the patients, and you go to the day 3 samples and the day 9 samples, and they are not there anymore. They've passed away in between different samples. So at first, when it was the busy period, that I found that personally quite difficult.
Yeah,
it was
absolutely.
tough.
Yeah, it was.
Because they're not all HCOP either, so it's not 80, 90 years old, it's 30, 40, 50.
And that was some of the feedback from some of the wider team that have come to help, that maybe don't really normally see a lot of deaths. So people from, children's or maternity or other areas like that, that they did note that was obviously quite mentally challenging when doing the data follow-ups. Is actually you kind of feel like, I think one of them said to me, at the end of the 60-day stay, you've been rooting for them all along, and then unfortunately, they've not had the outcome that we'd like, and found that hard. What kind of things have people been doing that they thought was really helpful for mental health? I've been using the Headspace, which Lucy knows about, because I keep going on about it.
I didn't realise that you could get it free on the NHS. Well, I kind of did, but every time I logged onto it, I had to pay for it, so I was like, I'm not doing that. But, it's really easy to do. You just put log in with your NUH email address. They send you an email, you confirm it, and then that's it. And you've got access to all this amazing stuff, which is really good. And they're quite short as well, aren't they, if you want to do it. You can do programmes.
You can just Google NHS Headspace, and it takes you to the right thing.
Yeah.
So it's really simple.
Colouring books.
Yeah. So I've been doing some mindful colouring.
Yeah.
One of the things I found helpful was NUH set up wellbeing rooms. So both at QMC and at City, they have got a space where you can get counselling, or if you just want to have a cup of tea with your colleagues, they've got that space. There are usually also snacks as well, which is also welcome.
Weren't the teams sort of like meeting there halfway through the morning once they were seeing patients, which was really nice to hear, wasn't it?
I think sometimes when you're working in the COVID areas, it's quite hard to get a break. So I think there's nowhere to go to have a break. So having the wellbeing rooms is really, really invaluable, I'd say. Having a little bit of downtime.
I really hope that they continue them.
I hope so.
Yeah. Just have to wait and see.
Also having the socially distanced lunch breaks and having lunch as a team.
Going outside as much as we can. Yeah. Especially when the weather was amazing.
The weather was great.
Not so great.
Maybe not today in the rain.
Or socially distanced walks if you can't have your lunch together.
Yeah,
that's good. Quite nice to go and do in the afternoon.
In the times of data, staring at a screen all day is a bit much. So going on a walk with your colleagues is very much welcomed, I think.
Do you know the children's teams have been doing exercise?
Have
So
they?
they told us, haven't they? Yeah.
Every day, 2 p.m, 10-minute exercise session.
Yeah, so I think maybe we're going to have to start doing that in green.
We'll do your 10-minute yoga stretch.
Yeah, so, after the coordinators meeting, we'll do a little bit of...
Do we have to bring Lycra with us?
You can wear Lycra, Julia, you can wear Lycra.
Lycra is optional.
I would love it.
Well, the shops are open now, so you can get work exercise outfit.
Matching purple. We have a dream Lycra outfit.
It'll have to be purple. Can you imagine?
Get your mum to sew a logo on.
Yeah.
Watch this space, everybody.
Do you know what's amazed me? All of the free stuff that people have given us so kindly over the time of COVID. I mean, it's really helped us, hasn't it? Not only the R&I hamper, but we've had
Dettol bags, so we couldn't find wipes anywhere. That was really useful.
Hand gel,
to actually get
amazing
supplies and
Crocs.
Oh yeah, we got Crocs.
It's just nice to be felt appreciated.
Yeah.
the chalk drawings on the drives from kids and the pictures in the windows.
Yeah,
it's been lovely.
And when you're leaving your shift at 8 o'clock, just in time for the clapping.
Nightmare on traffic afterwards.
Yeah, it's been amazing. We had those headbands made, and Nicola's neighbours brought us hundreds and hundreds of toiletries, which has kept us
snacks.
You know, it's kept us topped up with hand cream, which is very well needed at this time, isn't it?
Very true.
And WI lady gave us some amazing sausage rolls.
Oh my god, the sausage rolls!
I miss the sausage rolls.
I was going to say, you probably, they're about, they're as big as your hand, just of sausage roll heaven. Amazing. I can't, they were good, weren't they? Do you know what, I've got one in my fridge.
There you go.
Yeah, I'm going to eat it when I get home tonight. And of course my mum made all those lovely bags that were lined.
Very well.
No, Julia didn't actually want to use hers for a dirty uniform.
She hasn't had a dirty uniform in there ever.
That is respect.
It's the best use.
The best. But they reminded me of the pump bags that we had when I was in reception. We used to have pump bags up to school, and they reminded me of those. Really sweet.
Oh dear.
I do think the community spirit has been amazing.
Oh, absolutely.
I know,
throughout my entire career, I can't remember so much gratitude for the NHS, and it's it's such an important part of this country. And I can't ever remember there being so much gratitude or love for it. And I think it's really important that we all take that, and hopefully that won't go away. And
how did you all feel when we got the news that the dexamethasone arm in recovery and showing a benefit?
It's so exciting. Do you know what? We've done so much research, haven't we? And often it says very little effect.
Yeah.
And this was just bang, right, what we're doing. Like, we even had phone calls from doctors ringing the research team saying, I want to give my patient Dex, what do I do? We're like, give him Dex. We'll speak to your senior first. You should really make that decision.
Please read the paper first. Do not just give them.
I think another part of that is a lot of the trials we run, you don't get any results for years and years. So for a study to have started in March and to get some results by now it's amazing. So I think that's one of the big things to take away from me, because I've told all my family, all my friends, like, read this paper, because usually you don't hear for years and years. So I think it's amazing work that's been going on.
And it's a study that's the whole country is involved in almost, that everybody's interested in it, whereas lots of studies that we do don't really affect a lot of people, therefore there's not an awful lot of interest, but it's made it all worthwhile. That one thing has made all that hard work worthwhile.
And as researchers, people think what we do is quite boring and kind of not all shouldn't, when they go on the ward, think, oh, research is here again, whereas now they're like, research, I've got a patient, and it's a complete flip almost overnight. People are like, do what you want, if you need me, I'm here, which the day before they were still very helpful and very useful, but it's just a completely different attitude towards you as a person and as a researcher. Even like at home, people don't think what I do is boring anymore. They're like,
And how do you feel, like, obviously with all of the changes that's happened to us in our personal lives as well, is that there's a lack of control, but actually coming into work, working on the studies that are potentially going to give an answer to this, doesn't that actually just fill you with this, like, energy and motivation that, like, actually I'm making a massive difference, and actually the nation are, like, depending on us to get this answer so that we can beat this. So definitely. I think for me, I think it's definitely been a massive boost. In that actually, we're on a really important part of history.
It's something amazing to tell the grandkids, isn't it? You know, as you get older, when you're like 90 and a nursing home, I was around when the pandemic.
I might just tell my cats.
Hopefully it'll be the only pandemic. But do you know what? It makes all those amendments worth it, doesn't it?
Oh,
you know, those overnight amendments that comes through.
I mean, how many was there of recovery in those first 2 weeks or something? There was multiple. To keep track on, it was like, what's changed today?
Well, Megan's on number 18 for remap cap, so
Wow.
you know.
And I think we're on CRF 6.
Yeah.
Isaric?
Yeah. No, 9.4 for Isaric.
No, 9.5.
9.5.
Just to illustrate the point, it changes quite quickly.
Yeah. It's crazy, really. But yeah.
I think it's good as well. I think as a team, I know we've had loads of, we work as an overall research team, but our little team that we're in is, I think it's become stronger as we've added members from different teams.
True.
It's, I feel like a stronger bond towards the team.
Yeah.
And a lot more team spirit. It's gave me the kick up the arse I think I needed before the pandemic.
Well, do you know what?
You're a bit emotional there, aren't you?
It's like, speaking of emotions, did we get a bit over emotional at different things in the pandemic through the stressful times?
I have cried over chocolate. Over very, very trivial things that we can laugh about now. But it's been real
At the
tears.
time, it was not trivial.
It was fully serious. And I used to say, do you know what? I know I'm tired, but this is really serious. It's really down my face. Oh dear. Yeah.
It's been some fun times.
Do you know what? I wouldn't have wanted to have gone through a pandemic with anybody else though.
No.
I agree.
This team.
Yeah,
I think it's. I think our sense of humour has probably got us through it. Slightly wackiness. And poor Julia only started in December.
I'm in full agreement. Once
This is kind of your induction.
Yeah, my mentor didn't tell me that there would be a pandemic on the way.
Why don't you have a crystal ball?
Yeah.
Oh dear.
I don't think I'll know what to do when we go back to original studies.
Oh,
and
no.
events. I haven't quite got there yet.
I think all of us will have to have another all SIVs all over again.
Yeah. We'll be signing all sorts of stuff.
Yeah, exactly.
Oh, it doesn't matter.
It does make some of our original studies look fairly straightforward though.
Yeah.
When you look at what we've been dealing with, drugs we've been dealing with,
Yeah.
it makes, choice between antibiotics seem pretty
But then you engage with the same consultant that you've recruited patients with now and go, well, what's the problem actually? Just all that. So actually, it's just comparing two things. It's not a big platform.
Don't know what I'm going to do at 7 o'clock in the morning when I come in when there's not multiple wards.
I've only got one place to look at. I've got one study to do today.
Yeah, absolutely.
Or studying more diseases than just COVID-19.
Yeah, exactly.
Gonna forget what happens in heart failure and sepsis. Like, what's that?
What's the liver?
Go back to your What?
That
Kids
wasn't on
do
COVID,
that?
I don't know it. Sure.
It's amazed me actually how good people have been about approaching for multiple studies because it's all on the one disease. If that person has got that disease, they are the focus of many of our studies.
Yeah.
So going to them and saying, I've got several studies to speak to you about, and some of them have just been, yes, okay, let's talk. And, especially if they're not feeling so great, it has been amazing to see because it's rare to be approaching somebody for more than maybe 2 studies at a time. So when you're going with multiple studies, it's a lot for them to take in, really.
What's been the general consensus on the wards when you've been, because I haven't been approaching much, but when you've been approaching people, generally, most people are up for it. Or,
I think it's mostly positive.
I think it's around about 71.6% of patients that have come into the hospital that have been approached. Brilliant. So obviously the others are not eligible for whatever reason, but. And I think and then 70% are saying yes, which is amazing.
Really good.
That's great.
Yeah.
Obviously, these figures are today.
That's changing.
By the time, but it's absolutely, it's a testament to how you've all pulled together and that you've also integrated other people into your team and have done an absolutely outstanding job in trying times. Doesn't even feel like appropriate in this parallel universe.
Let's get unprecedented in there.
The pandemic is unprecedented.
But then I think, we've had various meetings where Lucy's said about the positives from the pandemic, and there are so many. So yes, it's been horrific at times and emotional, but actually there are so many positives, like you were saying about the improved team spirit and all those things, and the fact that people are pulling together from different areas, working in different ways, approaching for multiple studies at the same time.
We've made friends, haven't we, that we're elsewhere in the trust that we would never have met before. Friends for life.
Yeah, I was going to say, I think those friends will stay with you.
Yeah. Well, we've already decided that we're going to help each other out as and when we can, haven't we? So
absolutely.
It's just,
I'm not looking forward to the maternity studies. The rest I'm fine.
I'm sure Cindy will help you out.
They think they're going to need you to birth the baby.
That's my worry. Do not need that on a Friday afternoon, do you?
So I really hope that we're not around for the next pandemic. But what we're going to do if we do, what do you think that we're going to take away from this now?
I think we should keep copies of our spreadsheets.
That is the only thing we should take from this.
We've got it recorded now. Yeah, it's fine, it's working.
I think it'd be very different next time. We'd be prepared for it a lot more.
Yeah.
I think we should bulk buy Diet Coke and Haribo's.
Yeah.
Standing order.
Yeah. The pandemic's hit, right? We need this.
Yeah.
Not PPE yet.
Yeah,
Just these.
Yeah. We don't care about PPE. We just
have like certain shopping lists for certain weeks.
Yeah.
So like first week is Diet Coke and Haribo. Second week is whatever.
Christmas wine.
Do you know what? Next time there's a virus somewhere in the world and we say, it's not going to come to us, we're going to start preparing. It's going to come to us. We are going to be ready.
Yeah, rather prepare and not need to.
Yeah. So then we'll have an office full of stuff that we'll never use.
I think the Christmas wine, Haribo, and Diet Coke will probably get used.
Yeah. Definitely, especially in Dream.
Yeah.
Leaving comments for everybody. What's one word, and you can't use unprecedented, to describe your experience over, the last few months with the pandemic? What would you say? I'm going to start with Amy first.
Humbling.
Oh, that's really nice.
Yeah.
Gratifying.
Oh, these are good words.
Positively challenging.
Like that.
I'm positive.
I'm so proud. I'm proud of how everyone stepped up, pulled together, and just excelled.
Yeah.
And to be part of this.
Yeah.
Sorry, it's more than one word.
Well, you can.
Initially it wasn't.
Yeah.
It was. One word. Proud, that's it. No.
Oh, that's nice. Well, I was just going to say really weird. But I agree with all of you. Right, well, I think that's enough for today. We're hoping to bring some more podcasts to you, so please let us know what you'd like to hear and what your thoughts are on this. You can tell I've been listening to a few podcasts, can't you? So until next time, see you later.
Bye.
Bye.